Now we'll take some time and look at the central nervous system neurotransmitters. So look at their classifications. Okay, so look at this neurotransmitter, these neurotransmitters, they are like from the same precursor, so they fall under the same category, you understand? So it's more of like just list and pass, okay? Because all those neurotransmitters, we'll get to talk about them as we are into the central nervous system pharmacology now. Okay, so that classification of neurotransmitters, of course, you are classifying them based on what? This one and this one, they have similar structures, similar chemical nature, so they belong under the same class. Well, you can also come and classify them based on function. You can also come and classify them based on mechanism of action. Okay, but you should know that most of them that have the same chemical structure, of course, they should kind of like act the same way. I don't know if you're understanding me, because their chemical nature even makes it possible like that. So we have amino acid neurotransmitters. These ones, we have the ones that could excite, we have the ones that could actually what? Inhibit. So for the ones that could excite, we have examples, things like glutamate and aspartate. For the ones that could inhibit, like they reduce the way your neurons are active and all of that, we have things like GABA, we have glycine. Okay, then next category, we have the monoamine neurotransmitters. Those ones that are derived from the amino acid, and mainly they are important in your mood, important in arousal, and also what, how you recognize things. So under the monoamines, that's the broad classification, we have catecholamines, which is like a sub classification. Under catecholamines, we have examples like dopamine, have norepinephrine, we have what, epinephrine itself, that's what, adrenaline and noradrenaline. Okay, then next we have the indolamines, serotonin, just making that group. Okay, and also histamines. Okay, serotonin and histamine. No. Histamine is kind of like a special category itself. So how about the cholinergic neurotransmitters? That's when you have acetylcholine there. Okay, under cholinergic, it's involved in how you learn, in your memory, how I'm able to remember things, how I'm able to talk to you people here, how I'm able to give attention to you people. It's my acetylcholine that is working. So we have the neuropeptides. Those ones are short chains of amino acid, and most of them they act as modulators. So we have things like what? Endorphins, the enkephalins, we have the substance P, we have the neuropeptide Y, we have the oxytocin, we have the vasopressin. They are about purines. Okay, they say adenosine triphosphate act as a neurotransmitter in some synapses, right? We have adenosine. Then we have the gaseous neurotransmitters like the nitric oxide and also what, the carbon monoxide. Of course, these ones are less studied than the other ones. So this is what we have for the various classifications of neurotransmitters.